And we're back with the third episode of India After Corona. In this episode, TNI's editor G.S. Vasu speaks to noted economist and author Drèze. He's not only an expert economist, he's also an authority on famine and hunger and India's rural issues. Drèze takes us through why he believes the COVID pandemic is hardest on the poor, why our migrant workers may never come back as soon as we'd like them, and how the decisions taken during this whole pandemic have been made by a privileged few. More from Professor Drèze.
Thank you, Professor, for speaking to the New Indian Express. First question that I would like to ask you about migrant workers, Professor. A majority of them have gone back to the respective towns and villages. Even those who have remained in the cities would like, from whatever reports that we are getting, would like to go back the moment they're in a position to go back. And there is this concern that, given the experience they've had in the last 1 month, a good number of them are unlikely to come back.
That's right.
In such a scenario, what do you think is going to happen to, say, for example, states like Punjab and Haryana, where it's the migrants who do the large part of the cultivation and to the commercial operation, industrial operation?
What you're saying is correct, but I think the situation and the impact is going to be even worse in the poorer states like Jharkhand and Bihar, where people are now returning. Because you see what is going to happen now, as you said quite rightly, people are going to be afraid of resuming migration for some time. Certainly, as long as there are any lockdowns anywhere, they are going to be afraid of leaving their families and villages and getting stuck somewhere in a lockdown. So as you pointed out, this is going to create a labor shortage in some states like Punjab and Gujarat and Maharashtra and so on. But more importantly, it is going to create a huge excess surplus of labor in states like Jharkhand and Bihar that are sending labor to other states. It is going to create a crisis of livelihood because the wages are going to be under stress and the earnings are going to come down, and people will have to fall back on survival activities. We can already see it. People chopping wood from the forest and selling it for whatever they can because they have no other means of subsistence. So coming back to the issue of the return of the migrants, I think the longer we hold them captive and we prevent them from moving back, the more is going to be their reluctance to migrate again later on, and the more seriously going to be the economic crisis with that, both for the labor short states and for the labor surplus states.
What, according to you, are the solutions?
There's no simple solution. It's a very huge problem, but it seems to me that it would be better to start enabling some of them to return to their homes in a dignified and safe manner now, and to do it in a staggered and organized way, especially at this time when there are plenty of empty buses and trains and shelters that can be used for them and unused manpower in the public sector and so on and so forth. All these resources could be used to help them to go in batches to their homes rather than to hold them where they are for as long as possible and then to let the floodgates open. I think that would be a bad idea, even from the point of view of containing the coronavirus crisis. And I have a feeling that one reason why there is so much reluctance to let them go is not so much the fear of the virus spreading, but it's the reluctance of the employers in these states that are employing these migrant workers to let them go because that's their source of cheap manpower. Well, if
that feeling sinks in among the migrant workers, then it's all the more difficult to bring them back, right?
That's right. Absolutely. That's what I'm saying. That the longer we hold them, I wouldn't say captive, but we hold them where they are, and the more badly we treat them, the more they are going to be reluctant, the more reluctant they are going to be to resume migration after they reach their homes.
Are there any specific areas where you think employment opportunities could be created to these migrants in their home area?
I think that the obvious potential is in the Rural Employment Guarantee Act. In fact, here in Latehar, I'm very struck the fact that so many people now are asking for Narega employment under the Rural Employment Guarantee Act because they have nothing to do. They have been sitting around for weeks and they know that it may last for quite a bit longer. So naturally, they feel it's better to work on the National Rural Employment Guarantee Act and earn something, even if it's not very much, rather than to continue doing nothing. So I think there's a huge potential there. It's actually a very important opportunity to revive NREGA. Now, of course, there will have to be some safeguards, like maintaining distance at the work site. But I think that can be done. And if you say that we're not going to open a work site because we are afraid that people will not maintain distance, I think you're trying to impose a standard of distancing that this doesn't exist in those villages. Because in the villages, people may not venture very far because they're afraid of the police, but in the village itself, they continue to live more or less as they used to live before. And so there's a certain amount of crowding and so on. And to pretend that that's not there, and to say that we won't open a work site because we can't impose the standards, the ideal standards that we would like to see at that work site, I think that would be a kind of denial. And on the contrary, I would say that all the public spaces, including these work sites, are opportunities to impart to people habits of distancing.
The kind of economic mayhem it has sort of unleashed. Do you see a sort of a herd mentality among leaders when the crisis erupted? Or you agree that this was the only immediate inevitable solution?
No, I'm not sure if I would call it herd mentality. Because the question remains, why is the herd going in a certain direction? And it seems to me that the problem is not so much herd mentality as the fact that the decisions are largely being taken by a privileged class of people who are far more afraid of contracting the infection themselves than they are concerned about the consequences of the lockdown for poor people. That's not to say that the lockdown was necessarily wrong, but obviously the way it has been done with giving so little attention to the consequences for poor people and doing so little to help them during this crisis and during the lockdown, I think that does reflect a class bias in the framing of public policy.
Two independent data that are coming out. One from the World Food Program that says a further 130 million people could face acute hunger this year. How dire is the hunger emergency in India is one aspect. The other is that of the ILO, which says 40 crore workers are likely to be pushed into poverty because of the pandemic. Any sense of the numbers, and is there anything that we could do to elevate this crisis?
Well, I think that these numbers are a little speculative because obviously we don't know much about how long the lockdown is going to last, and even the baseline figures about poverty and hunger are not very reliable. For example, the latest poverty estimates in India go back to 2011-12. What I can say is that these figures are plausible. For example, when you say 130 million people could face hunger this year, well, if we remember that about 500 million people in India live in households that don't have a ration card, we are basically saying that something like 1/4 of them, of these households without ration card, may be exposed to hunger in the next few months. And I think that's quite a reasonable hypothesis. I think we should also remember that spare a thought for one important group of people who may face hunger in the near future, and in fact already now, and that is the elderly. Because in situations of scarcity, it's always the elderly who are the most neglected. And that's more than 100 million people in India. So we are basically talking of very large numbers. Whether it's exactly 130 million or more or less, we can't really say. But it's in that range that we are talking about.
While some are advocating a direct cash transfer, you have been emphasizing on the need for food transfers over the next few months. Can you please elaborate on that?
Yes. I think most people recognize that we need both food transfers and cash transfers in this situation. It's very important to realize that right now, it is the food transfers and especially the public distribution system that are keeping millions of people alive and secure from hunger. In the district where I'm right now here in Latehar in Jharkhand, you can see very clearly everywhere you go that people depend crucially on the public distribution system to feed their families. Now, on food transfers, I feel more needs to be done. In particular, I feel that the central government should be releasing much more food grain. It has enormous stocks of food grains. I think that's well understood. And it's not clear why the central government is not releasing more. For example, recently the Jharkhand government sent a request for a very modest amount of extra food grain to the central government so that more people could be covered under the public distribution system. And that was refused. So I think we need more food grain to even universalize the PDS if possible, at least in rural areas and urban slums, and also have on top of that emergency food distribution programs like community kitchens or distribution to migrant workers. I think that's also important in addition to the public distribution system.
While you have clarity about the situation in Jharkhand, are you getting inputs from other states in regard to the food distribution program, how efficiently it's happening or otherwise?
Well, obviously the public distribution system is not perfect, but Jharkhand has been one of the worst for a long time, and it is actually now working reasonably well in Jharkhand. Of course, there is a problem. The main problem is that many households still don't have a ration card. But those who have a ration card, now they are getting double rations. And even though it's not working perfectly by any means, it does work sufficiently well to ensure that a large part of the population at least is protected from hunger. And in many other states have a better public distribution system than Jharkhand, including neighboring states like Orissa and Chhattisgarh that are very poor. So I think that obviously it can be improved a lot more, but it works sufficiently well to play this part that I mentioned of the primary source of security for a very large part of the population at the moment. Because we also want cash transfer.
Isn't it the time when we have to, do away with people having this ration card and all that? Can't it be distributed based on, say, Aadhaar?
No, on the contrary, I think this is the time to realize what an important asset for the country the public distribution system is. Well, I think ideally, firstly, I would prefer ration cards to be given to every household, at least temporary ration cards for let us say 1 or 2 years in this situation. Okay. Now, of course, it's true that to do that, you may need 1 or 2 months. It cannot be done in a hurry. And in that interim emergency period, you may have to distribute food to people who don't have ration cards. You see, the thing is, what you need is not so much ration cards. What you need is a list of people to whom you are giving food. And I think once you have that list, I wouldn't even say Aadhaar. I would say give it to them whatever ID they may come up with, or even no ID.
One of the flaws that has come out quite starkly in the wake of this virus spread is the public health system in the country. What do you think needs to be done to put it back on track?
Well, I think the entire healthcare system has to be rethought. It has been neglected for decades. That's a quite well-known issue. And it's also a very privatized healthcare system, basically based on profit and also very poorly regulated. And I think it's well understood in economics that the profit-driven healthcare system is very ineffective, as well as being, of course, very inequitable. Ideally, there should be no profit-making in the field of healthcare. That may not be easy to achieve, but I think that the basic principle of the healthcare system should be what is called universal healthcare. In other words, everybody should have a right to healthcare in a situation of illness, to be taken care of by the society as a matter of social responsibility, and not have to pay for their own healthcare. That doesn't necessarily mean that private healthcare will disappear, because some people may still prefer to use the private health facilities that are there rather than public health systems. And other countries have done it at a time when they were not much richer than India. In fact, Thailand, which is a very impressive system, healthcare system based on the principle of universal healthcare, put that system in place around 2001-2002, when its per capita GDP was not much higher than it is in India today. So if Thailand could do that 20 years ago, I think India could do something similar today.
Can you specify 3 major failures and the 3 steps that need to be taken now in the light of the experiences we have had post the virus?
One is the neglect of the healthcare system. Beyond that, I think, is the lack of attention to human resources, through education, training, healthcare, social security. And one reason why Kerala is doing so much better than most other states, if not all the other states in this crisis at the moment, is that it has developed its human resources, and so it's much better equipped to face the crisis and to involve people in fighting the virus. So I would say healthcare, human resources, and then, of course, social security. The fact that we have a PDF in place is helping us a great deal in this crisis to avoid hunger and starvation. And similarly, if we had a better developed system of social security in general, including social security pensions, a better functioning Employment Guarantee Act, maternity benefits, and so on, it would have been much easier to go through this crisis and to avoid the kind of humanitarian disaster that is happening at the moment with this lockdown.